when I was pregnant, I had anemia and my doctor was super worried about me. Hello and welcome to another episode of Ask Me Doctor, brought to you by Motherhood.com.my. I'm your host Ifa, and today we have Dr. Sundar Gugan, visiting consultant ONG at Columbia Asia Hospital Petaling, Jaya, to talk about pregnancy, preparing for the unexpected. When I was pregnant, one of the things that kept me worried constantly was whether my pregnancy was going well. I realized that unexpected events can happen along the way in any pregnancy, and it's so important that I am prepared physically and mentally for what could possibly happen and know how I can reduce my risk.
This does worry a lot of expecting mothers. Let's talk about some important things that can help you get ready for the unexpected.
Doctor, maybe you can tell us about who is at risk for pregnancy, complications, and do we all have the same risk?
Anyone can be at risk of complication during their pregnancy. Some examples of health conditions or diseases that may cause complication during pregnancy are diabetes, cancer. Some people have high blood pressure, hypertension prior to pregnancy, while others develop it during pregnancy, and this can cause a baby from not getting enough blood. Kidney problems, epilepsy, anemia, being older than 35, being younger than 20, smoking cigarettes, drinking alcohol, taking illicit drugs. Of course, being pregnant with multiple babies, like twins, triplets or more. Having a history of repeated miscarriages, not once, like multiple times. Obesity, BMI more than 30. Having anorexia, BMI less than 20.
Maybe while pregnancy is a natural and normal process, it does come with risk for some women. Every woman is different and may have varying degrees of risk for pregnancy complications depending on their health status, age, and other factors. So as a new mom, being prepared for any potential pregnancy complication is important, as it can help to minimize risk and ensure that the best possible outcomes for both mother and the baby. Do you know that you could actually get covered as early as 13 weeks of pregnancy with Prudential PRUMy Child Plus prenatal protection plan? With this prenatal protection plan, every parent could enjoy a peace of mind in their journey to welcome their little precious one. That leads up to my next question, doctor. What are the most common complications of pregnancy?
Miscarriage. Miscarriage is a loss of pregnancy in the first 20 weeks. It occurs about 10%, about 1 in 5 pregnancy. Congenital disorders. If your doctor suspects the fetus has health issue or a congenital disease, you're at higher risk for the complication during the pregnancy. This may mean you need additional monitoring and your baby needs special care after birth. Preeclampsia is a blood pressure problem which occurs after 20 weeks of pregnancy. Occurs about 10% of people who develop this during pregnancy. It's a more common with the people who already has high blood pressure prior to pregnancy. After your baby is born and everything, it should go away, dissipates away. Gestational diabetes, as it mentions, is a diabetes which occurs during pregnancy. It happens because the pregnancy hormone makes the body harder for it to metabolize the blood sugar. So usually you will be given a sugar screening test during your pregnancy. So the condition usually resolves after pregnancy, and this is something which is quite very important to diagnose, because especially being Asian, there's a lot of people who actually have diabetes. So infections, viral and bacterial infection can complicate pregnancy, like urinary tract infection, which can causes preterm labor. There's also group B streptococcus, which can cause infection to the baby, which could be bad for the baby. There's also sexual infection, which also causes preterm labor and infection to the baby and such. And of course, we call the TORCH infection, which is like toxoplasma, rubella, cytomegalovirus and herpes, which causes congenital infections for the baby. Preterm labor. So preterm labor is a delivery before your gestational age, before 37 weeks, can cause a problem for your baby because the baby might be born with a lower birth weight and slightly underdeveloped organs depending on the gestation. Usually we worried about the lungs because they have difficulty breathing. Placenta increta. So the increta is when the placenta is embedded deeply into the uterine tissue and it's very difficult to come out after the delivery and causes severe bleeding and sometimes we need to remove the womb to arrest the bleeding. And the worst part of the placenta increta spectrum is called percreta. The placenta invades not only into the uterine tissue as well, it goes to the adjacent tissue like bladder, bowel and such. And not only does might require the removal of the womb, but there might be like injury to the bowel and bladder and such. Amniotic fluid embolism. It has a very high mortality rate, and usually we kind of diagnose it much late. The debris from the amniotic fluid or the fetus goes into the maternal circulation and causes cardiovascular collapse. It's almost immediate and sudden. Depression, anxiety and extreme sadness during pregnancy and mainly after post-delivery, it's overwhelming and can affect baby's development, the family. We have to be very vigilant about this, and if you notice something like the mother feels like having thoughts of harming baby, I think this has to seek medical attention. So you have to talk to your doctor about this during your prenatal appointments. Early detection and prompt treatment definitely reduces the chances of serious complication and managing the disease.
Thank you so much, doctor, for sharing this example. It's so important for moms to recognize these symptoms and seek help as early as possible. Pregnancy complications can be challenging, but remember that you are not alone and that there are resources available to help you through this time. In the event of a pregnancy complication, a prenatal insurance plan can help to cover the cost of necessary medical care and treatments, and that will provide some financial assistance and ensure that mommy and baby receive the best care and support they need for a healthy pregnancy and childbirth. I strongly encourage all new parents to have your prenatal policy in place as early as you can so that you have complete protection throughout your pregnancy. Can pregnancy complication cause a premature birth? What are the health effects on premature babies?
Premature birth is a birth which is baby being born before 37 weeks of pregnancy. Some health problems can raise the risk of premature birth, such as problems with the uterus, cervix, sometimes we call it cervical incompetence or placental issues, some infections, and many of the amniotic fluid and lower genital tract. Ongoing health problems such as high blood pressure, diabetes also could be the cause of premature delivery or iatrogenic premature. That means we facilitate the delivery for some issues. And of course, injuries or trauma to the body sometimes can cause premature delivery as well. Babies born prematurely may have more health problems at birth and later in life than babies born at full term. Because their organs did not have enough time to fully develop, the baby might have some issues, which includes breathing problems because the lung is not fully developed, so they can't breathe properly, they need assistance, feeding difficulties, sucking, taking in the milk, high risk of developing cerebral palsy, vision problems, hearing problems. Premature babies also needs to spend some time in the newborn intensive unit called the NICU. Premature baby stays in the NICU until the organs develop enough to stay alive by themselves without medical support, and some babies need to be in the NICU for weeks or months until they can breathe on their own, eat by their own mouth and feed themselves and maintain their body temperature and body weight. Babies born preterm are also at risk of developmental delays, and that can affect their behavior and ability to learn. Finding and treating health problems as early as possible can help premature babies lead to healthier lives.
I do know many parents who had premature babies that grew up to be healthy and happy thanks to advances in medical care. Even babies born prematurely are more likely to survive and thrive today than ever before. It is vital that your prenatal plan provides financial protection for premature birth and the associated medical care. Also, do not overlook the need for comprehensive protection against congenital conditions and child development disorders to ensure your child gets the necessary medical and professional help as early as possible, and you not having to worry about the cost of treatment should the unexpected happen. My next question is, do all premature babies go through cesarean section?
In some cases, premature babies can be delivered naturally, but it depends on the circumstances and the gestation age of the baby. For premature labor baby before 37 weeks of pregnancy, your doctor will evaluate the situation to determine the safest method of delivery for both mom and the baby. In some cases, if the baby is in a good position, which is basically what we call 𝗘𝗣𝗘𝗥𝗧, when the baby's head is down and the cervix is fully dilated, a vaginal delivery is possible. In other cases, an emergency cesarean section may be recommended for preterm births if there is such medical reasons, such as there are concerns for the safety of your baby and there's an emergency for you or your baby. If your labor is not progressing normally and there are complications such as bleeding during the labor, severe preeclampsia, the high blood pressure, those are some of the reasons why we might end up doing cesarean section.
Well, mummies, the difference between an emergency C-section and a planned one is the time you have to prepare for it. It is understandable to be concerned about the cost of a C-sec delivery, as it is generally more expensive due to surgical and medical costs. It is vital that your prenatal plan provides financial protection for emergency C-sec before 36 weeks gestation in the event of an unplanned early delivery. Also, do not overlook the need for comprehensive protections against congenital conditions and child development disorders to ensure your child gets the necessary medical and professional help as early as possible, and you not having to worry about the cost of treatment should the unexpected happen. So doctor, we all desire a healthy pregnancy, but can we prevent complications?
There are several steps that can be taken to prepare for pregnancy complications. Seeking a prenatal care, early and regular prenatal care can help to identify and manage any potential complications. It's important to attend all the appointments and to communicate very openly with your healthcare provider about any concerns of your symptoms that you may experience. Maintaining a healthy lifestyle, eating healthy diet, exercising regularly, and avoiding harmful substances such as tobacco or alcohol or illicit drugs can help to reduce risk of complications. Educating yourself. Learn about the signs and symptoms of pregnancy complications such as preeclampsia, gestation diabetes, preterm labor. This can help you to recognize when to seek medical attention. Building a support system, having a very supportive partner, family member, and healthcare team can make a big difference in your managing complication and navigating in the challenges that may arise during pregnancy. Remember, while it is important to be aware of the risk of pregnancy complication and take steps to prepare, it is also important to focus on the positive aspect of pregnancy and enjoy this special time in your life.
Thank you so much, doctor, for your valuable tips and advice. So mummies, remember that every pregnancy is unique and some complications may still occur despite taking preventive measures. It can be scary to hear that doctors have diagnosed a complication. You may be worried or even feel panicked that perhaps something you did or didn't do caused this to happen. These feelings are completely normal, don't worry. It may reassure you to know that nothing you did caused these complications. And beyond that, these complications are treatable. With early detection and proper care, you increase the chances of keeping you and your baby healthy. The best thing you can do for you and your baby is to get prenatal coverage from the early stages of pregnancy to ensure complete protection from the unforeseen. Prudential believes that new mamas deserve the right support during childbirth. That's why PRUMy Child Plus is designed for all moms and babies out there, providing comprehensive protection starting from 13 weeks of pregnancy and continues to cover your child until the age of 100. To learn more about how you and your baby can get protected with PRUMy Child Plus or to schedule an appointment with a Prudential representative, please visit the link below. We hope our moms-to-be have enjoyed our episode today. Don't forget to take part in our contest to win exclusive Prudential merchandise, and stay tuned for our next episode where we will be sharing more tips to support your pregnancy journey. So thank you so much for watching, and we'll see you again next time. I'm Ifa Hazim.
And I'm Dr. Sundar.
This is motherhood.com.my. Bye-bye.
Bye-bye.